At this time, I'll introduce our guest speaker. I think everybody knows Congressman Kennedy. He served 8 terms in the U.S. House of Representatives in Rhode Island's 1st Congressional District. Somebody asked me, how many congressional districts in Rhode Island? That was an interesting question. We'll get the answer. He's devoted his career and life to making mental health treatment available to every American who needs it. That's quite simply what he's been doing. And he was the lead sponsor and co-author of the Mental Health Parity and Addiction Equity Act of 2008. And of course, he worked on this legislation with his father, the great Senator Edward Kennedy, to open access to the mental health treatment for tens of millions of Americans who were previously denied care. He authored and co-sponsored dozens of bills to increase the understanding and treatment of neurological and psychiatric disorders, including the National Neurotechnology Initiative Act, the Genomics and Personalized Medicine Act, the Combat PTSD Act, and the Alzheimer's Treatment and Caregiver Support Act. Wow. He's co-founder of an organization, One Mind for Research, a national coalition dedicated to finding new treatments and cures for neurologic and psychiatric diseases of the brain that afflict 1 in every 3 Americans. He has journeyed a long way to be with us, and on behalf of the caucus and our Mental Health Select Committee, I want to express my deep gratitude. Thank you for sharing your time with us. It's a pleasure to introduce our honored guest, Congressman Patrick Kennedy. Patrick.
Thank you very much, Chairman, and I appreciate I really appreciate the warm introduction I got from my colleagues. Mr. Chairman, before I became a United States Congressman, I'm very proud that I served in the state legislature in Rhode Island for 3 terms. And so I certainly appreciate all the exciting work that happens in state legislatures, especially as Congress is paralyzed to move forward in very important ways. Many of the most important things that are being done in this country are being done at the state level. So you may ask yourselves, what am I doing here in California? Why not take my case to Washington, D.C.? And my answer is because you hold the keys not only to how people in California are going to be treated, those who are suffering from a mental illness and an addiction disorder, but it's going to be what California does not only for your own Californians, but what you're going to do for the rest of the country by the way you move forward and the model that you set here in California. And for those of us in other states, we all know that California is often the model for very important and progressive legislation. So just as I was testifying in the Commonwealth of Massachusetts, the place of my birth, a couple months ago, in front of their regulatory commission on mental health parity, is the same reason I'm testifying in front of you. And that is that the decisions that you make could, in reality, make the difference in what the federal government decides. So, honestly speaking, if you move forward with bills like SB 22, Senator Bell's bill to require reporting for accountability and transparency in how insurance companies make medical necessity decisions, you will be setting a standard that not only hopefully will be replicated in other states, but may even become a lesson learned as HHS and Department of Labor and the other agencies of the federal government adopt a final rule to implement the Mental Health Parity and Addiction Equity Act. So isn't it something? On my way here today, I picked up the newspaper, that liberal rag from the Northeast, the New York Times, and top editorial, today's paper, stuck in purgatory. Federal rules to protect the public haven't been imprisoned too long by the White House. These are rules that have been passed in the last Congress that have not been promulgated, laws that have been passed in the last Congress. Guess what? The Mental Health Parity and Addiction Equity Act, which I was honored to be the primary sponsor of, as Senator Bell said, along with my father, Senator Edward Kennedy, took the place of the late, great Paul Wellstone, who was our champion in Washington, who worked alongside of Senator Pete Domenici, and who I got to work with on the House side is Republican Jim Ramstad, ultimately signed into law by Republican George Bush. I make these references to party, even though party membership is irrelevant on this issue of mental health, because mental health does not discriminate between Democrats and Republicans. But it is important in this time of polarization in politics that we recognize that we're all in it together, and this is a truly bipartisan issue. But I mention this editorial because we need to mount a political effort that is going to allow us to get the final rule on this federal law that was passed in 2008. And if we get a final rule that is comprehensive, then not only will that rule protect everyone else in this country, it will help guide you in your deliberations. But ironically, it may be that you end up coming up with some of the proposals that influence what the final rule says. And so I make note of this is because many people outside our Sacramento and outside Washington, D.C. don't understand about this esoteric thing called rulemaking. But as we all know as lawmakers, we pass laws, but it's the administration that implements through rules and regulations. And that's where the rubber meets the road. That's where the real action is in terms of the determination of how these laws come to life. And what we're all talking about tonight is a law that has not received a final rule, meaning there is no clarification about what the legislative intent was when we passed the bill. But I'm here to testify as to what the legislative intent of the Congress was when we passed this legislation. Because as the author of that legislation, I know what was in the bill. And what was in the bill is very specific. And I think that it may help those of you who are fighting for implementation of this parity concept in this law in your own areas, here in California particularly, that you understand what the federal law requires. And ultimately, hopefully, we're going to get the federal government to implement, according to the letter of the law, what we meant when we passed this legislation. So in the legislation itself, we call for, as you know by the title of the bill, parity. That means equality. So before we go any further in talking about how we'd like to have mental health and we'd like to have coverage for addiction services, let's first stop and understand the most basic premise that unites us. And that is, we want equality. That should ring true to everybody. We as Americans strive to be a more open and equal society. We haven't always lived up to the model, but we've tried. And what this legislation basically says is we don't want anything more than the rest of physical health, but we are required by law to provide no less than what the rest of physical health gets in terms of coverage. So what we're talking about here is something as radical as the notion that the brain is part of the body. And it took, a lot of deliberation in Congress to try to figure this out. It took many years. And I think it's an anecdote to what the biggest challenge that we have in talking about this is just talking about it, is the stigma that surrounds these issues of mental health. So Senator Bell mentioned that I was 27 when I was elected to the United States Congress. I was 21 when I was elected to the State House, and I was 31 elected to Democratic leadership in Congress, and none of it had to do with my last name being Kennedy whatsoever. It was all my good looks and personality that got me. You're not supposed to laugh that much. But I got to Congress. I had been a co-sponsor of mental health parity in Rhode Island. You know, this was not a new subject. You all have been fighting for it for years. And I thought in Washington I would have to put my name down about maybe number 180, 200 out of 435 members of Congress. I thought you know how we all pass bills around in our state legislatures, we sign on. And you know, the prerogative for who gets to be the sponsor is usually held by our esteemed chairman, the most senior members of the ranking committees, of the important committees of jurisdiction, or the leadership, like our majority leader would have the first right of refusal, so to speak, on whether, you know,
They have Senator Steinberg just...
And President Steinberg, well, of course, you know, you have to have that kind of gray hair, you know, to demonstrate your bona fides as, like, the champion. Because it takes a long time before you get to be the sponsor of anything. That's the way it works. That's why my father got to be the sponsor of a lot of bills, because he was in the Senate for nearly 50 years. So I make this point because I got to be the primary sponsor of the Mental Health Parity and Addiction Equity Act as the youngest member of Congress from the smallest state in the country and in the minority party when I got to Congress in 2005, in 1995, which means that I was the lowest person on the rung in legislative parlance, okay? So the notion that I got to be the champion was, you know, you get me by default is basically what happened. Because there wasn't anyone else rushing over, as we often see our colleagues rush over to sign on, you know, that really great piece of legislation, whatever it is of the day, that all of our colleagues try to associate themselves with and bend over backwards to tell everybody that they're a co-sponsor of. But on the issues of mental health and addiction, as is in this case, stigma is pervasive, not only in our own lives, but in the life of this country. And it is the elephant in the living room, not only in our own families' lives, but it's the elephant in the living room in our family of our country's life. And I appreciate Senator Bell starting us off by acknowledging how many victims of this stigma there are in our society who end up in jails and homeless because of our failure to address this as a medical issue, as the proper issue that it should be addressed as in our healthcare system. So today I think we're at a turning point. Senator Steinberg's been after this issue for a long time. Others have. I think we're coming to a turning point because the attention of this country is at a critical point in terms of what is going to be the future of health care. And as we define what health care reform looks like, it's hard for us not to understand that the real secret sauce, so to speak, in the dollars that we could economize and the lives that we could save and the satisfaction and quality of life that we could provide are really in providing mental health coverage. You know, not just to the severely mentally ill, not just to those with substance use disorders, not just to those with intellectual disabilities, but to all Americans. Because this isn't just a special issue, a special interest issue for those of us who have children who have a developmental disability, or sisters or brothers who have addiction or depression, or mothers or fathers with Parkinson's or Alzheimer's. This is an issue for every single American because we all could do better with a checkup from the neck up. And wouldn't it be great in our healthcare system that the most important organ in our bodies not be ignored? Wouldn't it be great if when we broke our leg or had a concussion because of intoxication, that the emergency room doctor or our orthopedist or our general physician asked us about our anxiety, our drinking, our drugging, asked us these important questions that have more impact on our health than perhaps any other question that they could ask. God forbid they ever ask us about whether we have suicide ideation, with 36,000 Americans taking their own lives every year. God forbid that any medical physician in this country does not ask about our mental health. And we're in the year 2013, and we still don't have it as accepted practice that mental health is essential health to overall health. And the fact that we have to keep fighting this as if it's something separate is pretty striking and should cause us some pause right now, that we're even having to fight to have something as basic as the brain, the most important organ in our body, the organ that gives us our personalities, helps us communicate, is the organ that determines how we see the world, how we enjoy our human existence, how we relate to one another, how we communicate. That this organ in the body is disregarded in our healthcare system, summarily disregarded. The training given to our physicians is inadequate. The delivery system is a patchwork quilt. And the notion that we would not treat this as so essential to overall health is pretty shocking in this day and age. So I want to thank all of you for your leadership and say that you hold the keys, and on my view, for what the future looks like, because I really think we're in a formative time of rewriting the laws that are going to govern how we organize ourselves in our healthcare system. And you have been very big pioneers in writing, essentially, the laws that govern overall health care, to include, as Senator Steinberg has fought for, housing, to include those things that are so essential to stability in life, to include those supportive living services that are so essential, so that we get a health care system that is fitting to the title health care, not sick care system. And so I thought today, because I was invited by Chairman Bell to give you a brief outline of the parity bill to kind of buttress what you're doing here in California, that I would take you through briefly what it is that this legislation does. As I said, it's passed in 2008 and became law. As I mentioned earlier, youngest member, smallest state, minority party got to be the sponsor. Now, how did it pass in 2008? Well, you all appreciate legislative maneuvering and how you never want to know how a bill is passed. It's like, looking at a law passed is like making sausage. You don't want to see what goes in it. You just like it when it gets done. This is the story of mental health. So if you recall, 2008 was known for the financial collapse. Remember, our economy sank, our 401ks went down in the basement. The worry was we were going to have another Great Depression. Well, we were at the end of the legislative session, and my father was convalescing from brain surgery for a glioblastoma, and he was home. And we had passed the bill in the House. It was sitting on the desk in the United States Senate. My father called his friend, Senator Chris Dodd. Chris Dodd was not only his friend, but was substituting as chairman of the Health Committee that my father had vacated because of his illness. Well, we all know the name Chris Dodd, more associated with Dodd-Frank, because Chris Dodd was also chairman of the Banking Committee. So my father called his friend Chris Dodd and said, "Get that mental health bill passed." And Chris Dodd said, "I've just the answer." Congress had tried to pass this thing called the TARP, the Toxic Acid Relief Program, and it had failed. in the 10 minutes that it failed on the floor of the House, our stock market lost 6,000 points in the period of about 10 minutes. The bill failed, the economy sank further, and then all of a sudden Congress came back the following week and said, oh my God, we've got to pass something. As distasteful as the TARP bill was, bailing out the banks to the tune of $800 billion. So it was finally the 11th hour, the 12th hour, the 13th hour, if you will, because it was the last bill we were going to pass for that session. We all had to kind of run home to run for re-election. Chris Dodd put the TARP bill on 1424, the Mental Health Parity and Addiction Equity Act. So you're looking at not only the sponsor of the Mental Health Parity and Addiction Equity Act, you're looking at the sponsor of the largest federal bailout of banks in American history. That's me. Not Chris Dodd, not Barney Frank. It's funny. It would be funny if I were making it up. I'm not making this up. This is how laws are passed, and how tragic it is that this important bill that guaranteed equal coverage of mental health for all Americans was passed, and how it got lost in the shuffle of everything else that was happening. So most Americans do not know there's a federal law on the books. Why should they? In the wake of the economy collapsing, that pretty much took front and center attention. So my point is that we have been waiting for this final rule, and we haven't received it yet, and it's understandable why we haven't, because the White House had to first iron out the legal difficulties with the Affordable Care Act. That finally got ironed out, but we still are waiting for this final rule on the mental health parity. So why is this so important, and what is it that this bill requires? And why is this Senate Bill 22 so critical? What we want, again, is equality. I want to just repeat that till I'm blue in the face. We don't want anyone to think that we want anything more than what cancer gets, or diabetes gets, or cardiovascular disease gets. We want no more, but we demand no less in coverage. And so what this bill says is that you can subject mental health benefits to the same medical management practices as you do all the rest of physical health. But you cannot subject mental health and addiction coverage to any more onerous standards than you do the rest of physical health. In other words, what we want in SB 22 that you have before you in California is that kind of transparent reporting that Senator Bell has been fighting for, so that we can find out for ourselves whether insurance companies are employing the same medical necessity decisions in regards to mental health as they would the rest of physical health. And what does that mean? In the legislation, we define the categories of care. 6 categories of care: inpatient, in-network, outpatient in-network, inpatient out-of-network, outpatient out-of-network, pharmacy, and emergency services. So if these are all covered for diabetes, then they have to be covered for alcoholism. If they're covered for cardiovascular disease, they've got to be covered for psychotic disorders and schizophrenia and severe mental illness. If they're covered for all these other physical health issues, they've got to be covered for mental health issues. So all you need to do is take any health care plan, look at the numbers, determine whether leukemia is covered inpatient, in-network, outpatient, in-network, outpatient, out-of-network, inpatient, out-of-network, pharmacy, and ER. And if it's covered for leukemia, then it must be covered the same primary, secondary, tertiary care for mental illnesses and addiction services as the rest of physical health care. That's what the law says. The law is not ambiguous. It's very clear. But in order for us to give life to this law, we need to make sure that there is adequate monitoring, which means that you need to require public disclosure. And frankly, the feds, no matter what the final rule they come up with, it's going to be left in large measure to the states to determine what this accountability metrics is going to look like. Sure, there's going to be an appeals process on the federal level, but ultimately, you hold in your hands the very tools by which we're going to determine how effective we're going to be in implementing equality of coverage for mental health as compared to the rest of physical health. So as I outline here are the 6 classes of benefits. What we need to do is make sure that you have a process by being able to determine in any way, that the same way you would, in consumer protection for any other industry, that you have a process of determining whether that industry is complying into the spirit of the law. And you have a process of doing that. Now, up until now, what have we relied on? We've been relying on insurance companies to self-report. That's obviously not very effective. Many insurance companies don't have to worry about covering their trail because they have no trail to cover, because none of this information is public. And it only takes legal action before we get full disclosure on what their medical necessity determination practices are. We cannot rely on having lawsuits in order to find out information that ought to be in the public domain to begin with. So I would encourage you to continue on your efforts to require this public disclosure. That is the kind of sunshine laws that here in California you are known for. It is consistent with everything that you've always been fighting for. And that is just to have the public have an ability to know how the decisions that are being made that affect them in the most important way possible in their health care, how those decisions are made. As public office holders, that is the most basic responsibility that we have to our constituents, is to make sure that we are able to provide that transparency in terms of how decisions that are being made that affect their lives are executed. And we cannot have that adequately done if we don't have that information made readily available. So I encourage you to continue on your efforts. Obviously, this is going to be the area where we're able to determine whether the same degree of effort, maintenance of effort, is being made to cover mental illnesses and addiction services as is being made in all other areas of physical health care. So I mentioned the final rule from the federal government for a reason. Obviously, we can't begin to find out how insurance companies are measuring up if we first don't know what the rules of the road are, if we don't know kind of what the scope of services are going to be in terms of those expected to be provided on an equal basis with the rest of physical health care. So that is why this final rule on the Mental Health Parity and Addiction Equity Act is so crucial, and why we're waiting from the Department of Labor and HHS and Treasury for the final rule on the parity bill. But I'm here today to say to you that you could influence how that final rule is ultimately written. If you come out with the kinds of requirements and public disclosure requirements and transparency and reporting requirements that you have with SB 22, I think that's going to help us, give the feds the kind of backbone that we need them to have in order to really promulgate a comprehensive final rule. And why do we especially need a final rule that's so comprehensive? Because the historic discrimination against mental illnesses and addiction is so deep and so long-standing, and shame and stigma so pervasive, that we need to have a method of being able to really hold those who would otherwise take advantage of that feet to the fire in ensuring that we're specific when we say this is what we expect to be covered. Because if not, many of those in the midst of suffering are not going to be able to speak up for themselves. And it is the responsibility of government to be the voice for those who are voiceless. And this issue of guaranteeing specific oversight and compliance with this law is so crucial to making sure that we do not further diminish people's opportunity for recovery, because they have to fight a battle twice. Once they've got to try to recover, and in the process they've got to fight their insurance company or whatever the public plan is that is discriminating against them and their illness. People should not have to fight twice. Fight to get well and fight the stigma and discrimination that's associated with their illness. I will conclude by saying that this fight is not only a moral issue, because who amongst us would trade places with someone else whose family member has a child with autism, or a parent with Alzheimer's, or a brother or sister with schizophrenia, depression, or addiction? If it's your family, which it's every family in America, why would you be content with those who counsel patience and delay and say, we don't need to do this now, let it work itself out in the next few years? They said that 50 years ago when it came to civil rights. Thankfully, we pressed forward. We haven't achieved full equality, but we made great progress because we weren't afraid to move forward, and we had to move forward. And my feeling is we cannot wait, because there but for the grace of God go each and every one of us and our family members. And if it's all right with you that one of your family members is treated that way and you don't think that it's a big deal, well, you're, I think, in the minority, because I think there are more Americans who know how important it is to their own family, and who would not tolerate, and who do not tolerate, the fact that their families are discriminated against in this way, and continue to be discriminated in this way. And that is why we need to move forward. Secondly, the economic issue. Parity has the best benefits for the Fortune 100 companies. Now, why does Wall Street provide the best mental health benefits in the marketplace? Is it because they have this big bleeding heart and want to just be compassionate and, really paternalistic to their employees? No. They provide the best mental health benefits. Why? Because they want the best workforce. And they recognize that providing good mental health is not only a great way to get a very productive workforce, it's also the way that they reduce their other health care costs. So let's not scratch our heads and try to think that we're doing this out of the goodness of our heart, even though many of us are motivated by this. This makes economic sense. And if you don't believe me, then go ask the top Fortune 100 companies why they provide such generous mental health and addiction coverage benefits. That should make the case for itself. But the final argument, I would say, is for our patriots, our returning heroes from Iraq and Afghanistan. And here in California, you have 60-some thousand returning veterans in the last few years, in the next year with the downsizing of the military. It is enormous. And many of them are Guard and reservists, which means if they suffered the quote-unquote signature wound of the war, which is traumatic brain injury and post-traumatic stress, that they often don't avail themselves of coverage because they feel stigmatized by these illnesses. And if they ultimately do need treatment for these invisible wounds of war, they're going to get that treatment through their employer-sponsored health plan, which means that, the employers in this state need to have good coverage for mental health and addiction services, because how many of them want to wake up one day and find out that the employees that they have in their workforce who are being denied the care are returning heroes? I think that might be a wake-up call to management in this country, in the top echelons of corporate America, to think twice about what kind of medical management practice and what kind of administrative benefits manager they're going to want to have for their health care. Are they going to want one that just severely limits mental health and addiction services when those that are going to get compromised are the people in their employment and those particularly who are returning heroes? I think it's a wake-up call, and I think it's going to be something that takes our movement to the next level, because major insurance companies are not going to be able to distinguish between employees and employees who are returning heroes. So it's going to behoove them to just get it right the first time and make sure these benefits are covered for all their employees. I will conclude by saying clearly a lot of this is going to end up going to the courts, but to the soonest degree that we can in government clarify what we mean, the more we're going to allow there to be clarity from the beginning and not have to fight this fight over and over and over again in the courts. It is my hope that what we do with what you do here in California, what we do on the national level in other states, can help define this issue before it's left to a constant back and forth and more people having to lose their lives because of inadequate coverage. So what do we need from all of you? We need you to encourage your folks that you know, that you work with, to report violations of the Mental Health Parity and Addiction Equity Act. The only way we're going to breathe life into this is if we have people willing to appeal their decisions, and if we have people willing to report the discrimination that they face. So obviously we're going to need this in all of our areas of government, both federal and state and local. I put up here a couple of the contact information for those who would take your appeals. I also put up the parityispersonal.org, because we're trying to build a national movement where we can get people who otherwise would feel isolated by being denied care and get them to understand they're part of a much bigger battle for equity of care and coverage all across the country. Often, as you know, many people feel isolated in their illness, and they feel further isolated when the insurance companies force them to drag out a fight. What we want them to know is they're not alone, and that there are many others who are also fighting. And if we can ever put everybody together, we'll be a lot stronger united than we are divided. And that is the whole nature of our effort today, to get people to speak up, as difficult as it is, to speak out when you are suffering not only the illness but the shame of that illness. So I leave those important contact information for you to pursue after this hearing. If you're interested in making any kind of appeal, we encourage you to do this. This is only going to happen through political action. We didn't wake up one day and all of a sudden say, wouldn't it be nice if we all treated each other equally? Civil rights passed because it was an issue that was forced upon people. We just saw the Supreme Court strike down Defense of Marriage Act because people petitioned and appealed for that unjust policy. We need to continue to appeal. And the only thing that's going to ever make a difference, as my colleagues know, in this issue that's permanently going to make a difference, is that public advocacy. So we really need consumers to speak out. And in that regard, I am someone who's in recovery, and I struggle every day with both a mental illness and with an addiction and substance use disorder. But I am able to live in recovery today because I have the kind of care that treats my illness as the chronic illness that it is. And I think that hopefully we'll have a system of care available to everyone that treats their illness as the chronic illness. We treat diabetes and treat it as a chronic illness, prevent it. We treat asthma. We try to prevent it. We don't wait for these illnesses to become critical before we treat them, all except mental illness. If we compare mental illness to cancer, we would be waiting till it became a stage 4 cancer before we treat the mental illness. That's how we treat mental illness today, when it's life-threatening. If it were like diabetes, we'd be waiting till you went blind or needed your one of your limbs amputated. We don't do that in the rest of physical health. Why do we allow that to be the way we treat mental illness and addiction? We need to change this. And hopefully with your public support, we can begin to change things so that we treat mental illnesses and addiction the same as we do the rest of these chronic illnesses. And I thank you so much for your attention.
Thank you. Thank you. Good